One of the important questions if you're having surgery is what are the potential complications from the surgery, and also how long is it going to take me to recover, what are the side effects, et cetera, et cetera. Well, it obviously depends on the nature of the surgery that you're having, but in general, almost all surgery, we talk about the risk of anesthesia, which is extraordinarily small. The other risks that we worry about are infection and bleeding. And again, in the hands of highly experienced people, those kinds of complications should be in the neighborhood of 1%, probably no higher than 3%. And you should ask your surgeon what his or her complication rates are, experience, etc. Now, then when we talk about recovery from surgery and other side effects, if we're doing a mastectomy, we've now increased the magnitude of the surgery significantly. And with a mastectomy, there are two choices. One choice is to have reconstruction, either done with an initial expander called a tissue expander, and then eventually a permanent implant, or to use your own tissue. If you're not having reconstruction, then the concept is to have the skin lie down flat on the chest wall so that it'll be easier to wear a prosthesis inside the bra. In general, this level of surgery requires drains that are in place. The drains are usually there anywhere from 7 days, perhaps up to 2 weeks or a little bit more. Generally, most surgeons use antibiotics while the drains are in place. And then it's the whole range of motion of moving your arm and moving around. And most all of us now are recommending that you work with a physical therapy department both before your surgery to get used to the range of motion exercises that you need to do, as well as doing those exercises post-operatively. In general, with healthy people, the recovery even from mastectomy, including the temporary tissue expander, is in the neighborhood of 10 to 14 days. Most people tolerate these kind of procedures extremely well. So this is sort of an overview of the kinds of things you should be talking about with your surgeon as far as the nature of the surgery you're going to have, the potential side effects, and the potential complications.